Hello everyone, it's me, Golden Sarah from your friendly dental squad, Group 2.
And I'm Carol. Today, our group will be sharing with you all the basic things you need to know about the bloodborne pathogens and the common oral and respiratory disease that dentists might be exposed to in the dental clinic.
What are bloodborne pathogens anyway? Have you heard of them before? Well, if you haven't, let's dive down to its definition and examples.
Bloodborne pathogens are basically microorganisms that can spread disease when they come into contact with bodily secretions from the afflicted person, including blood. Among the bodily fluids that are discharged include semen, saliva, tears, mother's milk, synovial fluid, amniotic fluid, and secretions from the vaginal area. Furthermore, it possesses the ability to cause fatal illnesses and other serious conditions.
Example of common bloodborne pathogens and the disease they inflict, that is, disease caused by bloodborne pathogens, are 1. Hepatitis B, commonly known as HBV, hepatitis C, HCV, and acquired immunodeficiency syndrome, generally known as AIDS.
Wait, does this mean we can get exposed to bloodborne pathogens anyway?
Technically, yes.
You see, people who operate in places where they are exposed to blood and other potentially infectious materials run a severe risk of contracting a blood-borne virus hepatitis B. Drugs, poisons, inflammatory conditions, viral infections, and diseases that cause liver inflammation can all cause hepatitis, which is described as such with virus included.
I see, that's interesting. What about HBV?
HBV is easily killed when found outside of the body for as long as the killing agent comes into direct contact with the virus. In comparison to the bacteria, spores, and Microbacterium tuberculosis, the hepatitis B virus is easier to get rid of. HBV can spread percutaneously through the skin or permucosal through the mucous membrane when infected body fluids come into contact with healthy body fluids, as occurs after childbirth, sexual activity, or contact with contaminated needles or other sharp objects.
As regards hepatitis C virus, previously known as parenterally non-A or non-B hepatitis virus, HCV is the most common chronic illness in US. Most people living with this chronic infection are unaware of its presence in their body, since they are not clinically ill. Infected individuals run the risk of contracting this illness from others, thereby developing chronic liver disease or other HCV-related conditions.
Well, that was definitely something. What about AIDS?
Good question. The human immunodeficiency virus is the cause of the disease known as AIDS or HIV, an increased risk of infections and specific types of cancer. Exists in people with acquired immunodeficiency syndrome. Typically, immune system compromised individuals are more likely to be affected by these illnesses unless they can catch the virus themselves.
HIV antibodies frequently appear 6 to 12 weeks after the original infection, and 95% of those who are infected have developed these antibodies. A person is referred to as HIV positive when they have HIV antibodies, which indicates that they are infected with the virus. Oral lesions are one of the early signs of AIDS.
Infection caused by fungi, bacteria, and viruses, as well as cancer like Kaposi sarcoma, recently linked to human herpes virus type 8, and non-Hodgkin lymphoma are all examples of oral disease. There is a slight chance, but it is unlikely that HIV could spread from dental patient to dental personnel.
So now that we are done with our discussion on bloodborne pathogen, let us now talk about oral and respiratory disease that we as dentists and potential dentists or future dentists run the risk of being exposed to in the dental clinic.
Both oral and respiratory illnesses can be unpleasant and contagious. These disorders frequently affect the lungs and the oral cavity. Appearances of lesions and the occurrence of cough are two typical indicators that possibly indicate illness. Patients who also test positive for respiratory and oral conditions, but nevertheless go to the dentist, have a greater risk of infecting the dental staff. Common examples of oral and respiratory diseases that dental practitioners may be exposed to include the following. Additionally, the following are some of the ways that the aforementioned respiratory and oral infections are spread. First, a person may come in contact with the virus in sores, saliva, or surfaces in or around the mouth. Or second, there was an inhalation of aerosols from the vesicular fluid and from respiratory secretions that also may be aerosolized. In order to stop or control the spread of viruses and diseases, it is important to note that one must be disciplined as to keep themselves sanitized by consistently washing their hands, wearing face masks, and wearing the appropriate PPE whenever they are to come in contact with people affected by them. In hospitals, clinics, and laboratories, wearing of personal protective equipment is a must.